I was in severe pain on my left side, and it got worse and worse and worse. And over time, my breasts start to look like an elephant trunk. My name's Heather, and one of my breasts looks like an elephant's trunk. My left boob looks like a deflated water balloon, and my right side implant is starting to get disconnected from my breast tissue.
I do a lot of corrective breast implant surgery, and in fact, I actually did one this morning that looked a little bit like hers. So let's find out a little bit more about why her breast looks like an elephant's trunk.
I've had 3 surgeries, and when I came out of my last surgery, my left breast was higher than my right breast.
So why would one breast sit higher than the other? Well, there are a lot of reasons, and let me list a few of them out. First of all, some people, they just have a higher breast on one side than the other, and I see this in patients all the time prior to surgery, and if I see that prior to surgery, I'll usually tell them, hey, one breast is higher than the other, it's probably going to be like that afterwards too. Another reason why one breast could be higher than the other is because of swelling or bleeding. If you've got excessive swelling or excessive bleeding on one side versus the other, that's going to fill the pocket up more and cause the breast to look higher. And the third reason is just bad technique. If you open up a pocket for an implant on one side and you open up a pocket on the other side, but those pockets are uneven, they're going to sit unevenly too.
I was in severe pain on my left side, and it got worse and worse and worse. And over time, my breasts start to look like an elephant trunk.
One breast elevating and feeling hard and painful after an operation like this could be a sign of what we call capsular contracture. Basically, every time you put an implant into the body, your body will create scar tissue around it, in everybody. In a small percentage of cases, that scar tissue can get thick, it can harden, and when it hardens, it can actually elevate, and the pressure from that hardening can create pain. Looking at her photo here, that's definitely a possibility, is that she's got a contracture on her one side, but not as much on the other. Now, this is the most common physical complication that we see with breast implants, and there are a lot of things that we do during surgery to try to lower the risk of this happening. And that includes using an antibiotic or betadine rinse with the implants, changing our gloves prior to putting the implants in, using an implant funnel, and then using a medication like Singular after the operation.
You see this? That is called an animation deformity.
Breast implants can be put either above the muscle or under the muscle of the chest. When the implant is placed underneath the pectoralis major muscle, when that muscle flexes, it can cause the implants to shift outward. This is called an animation deformity, and pretty much everybody who has breast implants that are under the muscle will get an animation deformity. Now the big question is how much under the muscle is the implant? If the implant is completely under the muscle, which is the way some doctors do it, then the animation deformity can be quite severe. If the implant is only partially under the muscle, we call that a dual plane pocket, then that animation deformity can be minimized, but it will never completely go away if you're under the muscle.
In addition, because the implant is so high, her natural breast tissue is hanging off of that, called a dissociation deformity.
So Dr. Dubrow is describing what happens when you have an implant sitting high on the breast and the breast tissue basically falling off of it and drooping below the breast. I typically call this a waterfall deformity because it kind of resembles that breast tissue that's fallen off of it, kind of like a waterfall. Some people call this a Snoopy deformity because they believe it looks more like Snoopy's nose.
For Heather's surgery, I will make incisions below her areolas and remove her old implants.
I love Dr. Dubrow. I think he is a fantastic plastic surgeon, but I do not like that approach. Making the incision around the areola has been shown in studies to have a higher risk of capsular contracture, which is a problem that we think she might have starting out. So typically, instead of making the incision underneath the areola, I usually make it underneath the breast, just above the crease. That way it's well hidden and it has a lower risk of a complication like capsular contracture.
I will then build walls out of scar tissue to fix her synmastia.
Synmastia is the scientific name for uniboob, and it's basically when you have two breasts that are so close together that sometimes the actual implant pocket can be connected, and you can actually have a connection or a tunnel between the two breast implant pockets. So he believes she has some type of synmastia here, and he's explaining how he would correct it.
On the right side, I will release scar tissue to fix her capsular contracture, and on the left side, I will remove any scar tissue and release the muscle causing her breast to animate.
So it sounds like Dr. Dubrow thinks that her implants are sitting high because of capsular contractures, because of scar tissue. But there's another reason why those implants can sit too high on the chest, and that is unreleased muscle. If the implant is completely under the muscle, that pectoralis major muscle could be acting like a sling to hold the implants up too high. That can cause severe pectoralis animation deformity, like he mentioned earlier, but typically it doesn't cause pain like what she's complaining about. So the big question here is, are her breast implants sitting too high because they have a capsular contracture, or are they sitting too high because the muscles are acting like a sling to hold them up too high?
My hunt for the secrets of healthy and glowing skin have all led me here, and I aim to find out why. I'll get to the bottom of this skincare mystery.
There's no mystery here. It's just Youn Beauty. Our products are packed with all the necessary ingredients that you need to help hydrate, protect, and revitalize your skin. It's really just that simple.
There's no way it's that simple. I'm on to you, bub.
Check out our online store at younbeauty.com or download the Youn Beauty app on your phone to order yours today.
Finally, I will insert a new pair of implants and decide if Heather needs a breast lift or not.
If the implants are artificially sitting high on the breast, it can cause the breast to look like it's droopier than it really is. And I see this in my patients all the time when I'm doing corrective surgery. In these situations, she has that waterfall deformity where the breast tissue is sitting lower than the implant. If you allow the implant to settle into where the breast tissue is, a lot of times the breasts look actually less droopy than they did prior to surgery, and a lift is technically not needed. Now, the main benefits of avoiding doing a lift in her situation is you can avoid the scars of a lift, which those scars are long and there are a lot of them, and you can save significant amount of time in the operating room and therefore save the patient a significant amount of money.
So this is a 270cc implant.
A 270cc implant is actually a fairly smaller implant. I consider middle of the road sizes to be between, let's say, 300 and 400 cc's, and so this is definitely on the conservative side.
The surgeon didn't release the lower part of the pectoralis major muscle. The muscle wasn't released properly, so it shoved the implant towards the center, giving her the look of synmastia.
Oh my gosh, no joke. I literally corrected one of these this morning, like 3 hours ago. I had a patient who came in and she had synmastia. She had implants that were placed literally 23 years ago, and her breasts were really close to the middle. I brought her into surgery and I found that on the one side where the breast was moved over, the muscle was never released and it was basically pushing the implant towards the middle. It looks like in her situation, this is kind of similar to what Dr. Dubrow was dealing with. Very, very interesting.
We're going to release this lower part of the muscle, completing the operation that should have been done years ago. She didn't have a complication of any kind. She just had a bad operation.
Whenever breast implants are placed under the muscle, it's usually best to release the muscle that sits underneath the implant, because that muscle can hold the implant too high and create a waterfall deformity like we're seeing with this patient. The problem is depending on the way that those implants are placed, sometimes you just can't divide those muscles. If you put the implant through the belly button, usually those muscles cannot be divided if you want to or not. You just don't have the access to do that. If you place the implant through the armpit, it can be possible to divide those muscles, but you usually have to have endoscopic assistance. You need to be able to look into that pocket and use special instruments to divide that muscle. Unfortunately, there are a lot of plastic surgeons who just rip open a pocket, throw an implant in, and they don't really even pay attention to those muscle fibers that need to be released, and then you can get a result like what we're seeing with her.
Had your doctor spent 15 minutes releasing the lower insertions of the muscle, you would have had this problem.
Wow.
So it sounds like her doctor just didn't release the muscles, allowing those implants to settle in. But my big question here is, she said she had 3 operations. What was this doctor doing during 3 operations if they're not going to correct this very, very simple issue? I mean, who was this doctor?
Oh my gosh. They look awesome.
Right?
I could cry right now. Like, they're the prettiest boobs ever.
I'm so excited to see how she looks. This is actually one of my favorite operations to do because it's such a simple fix and the breast shape changes and the patients are usually so happy from it that it's a small amount of work for really big, big results. And here's a picture of a patient of mine who I fixed up for this exact same problem. This was just a few years ago. You could see releasing that muscle, such a better result.
Before my surgery, my left boob looked like an elephant's trunk. I was in so much pain, I couldn't even saddle my horse when I wanted to ride. I feel hotter than ever, and I'm ready to get out there and start dating some guys.
Well, her problem and solution ended up being pretty simple, but it's not always simple like that in plastic surgery. What about a patient who had flesh-eating bacteria of her breast implants? Yes, flesh-eating bacterial infection of her breasts, causing her implants to come out and giving her what she calls zombie boobs. Take a peek at this video right up here where I react to an episode of Botched where a woman deals with exactly that. And remember, eat real food, use clean skincare, and always auto-juvenate before you operate.